More news now. Maine's most vulnerable children must receive behavioral health services to keep them from being placed outside their homes. That's according to an agreement announced earlier this week by the U.S. Department of Justice.
The settlement ended a lawsuit filed against Maine in September, where the feds alleged the state's failure to provide treatment beds and services had left dozens of kids with mental health problems and developmental disabilities stuck in emergency rooms statewide. News Center Maine's Vivian Lee shows us why parents and advocates are hopeful the agreement will lead to a new system of community-based services.
The settlement is clear. Maine is required to strengthen its system to ensure that children receive behavioral health services in their communities. That includes timely access to care, crisis services, and boost staff that will work with the state's most fragile kids with better pay and training. State officials also must develop a plan within 120 days to implement a new system. While it's unknown how much state funding is required to bring Maine into compliance, the plan will be overseen by an independent reviewer.
There's going to be a level of transparency that wasn't there before, so that advocates and families can continually to push the system towards what needs to happen.
Nancy Cronin is the executive director of Maine's Developmental Disability Council. She remains concerned about the dozens of children currently on wait lists for services. Some are stuck in emergency departments waiting for a pediatric treatment bed, while others remain in residential treatment facilities out of state.
While the state is building for tomorrow, we have to take care of the children today.
There is a need for something different.
Natasha Suleiman's son Luke is on the autism spectrum. He spent years waiting for in-home specialized services to help him live independently. At 16, he spent a year in Spring Harbor Hospital waiting for a placement in a step-down residential facility. Natasha feels Maine needs to invest more in early intervention programs and now has one chance to get it right.
What's happening to kids now in emergency rooms and residential facilities being sent out of the state because there aren't children's residential facilities. I understand that's a huge problem, but if they don't do it the right way, right now, it's never ever going to be fixed.
In a written statement earlier this week, Governor Janet Mills said her administration has spent more than 2 years addressing children's behavioral health issues. Maine's Department of Health and Human Services has reduced the wait list for home and community-based services by more than 40%. I shared many of the U.S. DOJ's concerns, many of which preceded my administration, and we have worked closely with the legislature to invest hundreds of millions of dollars to strengthen the system, important reforms which we believe in and we will continue to implement, Mills said. Luke is now living in an adult residential home in Lewiston where he is thriving. There is new hope now that Maine will one day have a stable safety net ensuring that no more kids fall through the cracks. Vivian Lee, News Center, Maine.
The agreement will be in place for 6 years and terminated only once Maine is in full compliance.